Let us pray. Gracious Lord, Heavenly Father, we thank you for your love, your grace, your peace, your forgiveness. Help us to be bold in this time of a changing landscape, to keep in mind the safety and welfare of all people, the desire for worship and education and fellowship and service. Help us to look at the risks and the gain, and to help make our local congregations make the decisions that are best for their situation. In Jesus' name we pray. Amen. Kathleen, are you going to start off?
I can start by introducing myself. My background is nursing, public, and I'm a member of Grace Lutheran in Hermantown, and I'm the person on Grace's SMART team.
Kim, would you like to introduce yourself, please?
Yeah, hi, everybody. I'm Kim Downer. My background is in public health. I am faculty at UMD in the healthcare management program, and I'm a member of Lutheran Church of the Good Shepherd in Duluth. And I've been on their SMART team for about a year as well now, too. Thanks.
And John.
Hi, I'm John Moe. I'm a member at Trinity in Hovland. I am also a nurse. So yes, we're predominantly nurses on our team. I am a retired college professor. I currently am working up in Grand Marais doing staff development at the hospital and long-term care center. And I've also worked clinically in just about everywhere that nurses work.
And who's going to start us off?
You know what, I will, because I actually prepared something to show with this, and I know I let Kathleen and Kim preview this, but I'm going to do this, so give me a moment to do a screen share. And, oh, let's see here. Is it showing?
It is.
Okay. That's always a question when I do this, if it will show or not. So I wanted to start out with this quote from Martin Luther that's been making its round in the social media, but I think it's very important to think back. He was alive during the time of the plague, and he didn't run away from it, but he didn't ignore it. And this quote that has been circulated, "Therefore, I shall ask God mercifully to protect us. Then I shall fumigate, help purify the air, administer medicine, and take it. I shall avoid places and persons where my presence is not needed in order not to become contaminated and thus perchance infect and pollute others, and so cause their death as a result of my negligence. See, this is such a God-fearing faith because it is neither brash nor foolhardy and does not tempt God." And so throughout Lutheran history, we've been faced with these, and, you know, we've met it. One of the things that gets confusing for people is we talk about guidelines or recommendations versus a mandate. And to be clear, the guideline or recommendation, it's a suggestion, but it's best practice based upon the available scientific evidence. The mandate, that's the legal requirement that we have. And so I wanted to make sure people are clear on that. We have had a mask mandate in Minnesota until recently. That was a legal requirement to wear the masks. The guidelines or recommendations have been coming out from science saying this is who should and does not need to wear. in talking about the COVID vaccine, and Kathleen, I'm going to turn it over to you in just a couple minutes on this one, to remind everyone that the vaccine is to prevent a severe infection. It's not to treat it. And I have heard related comments out in the communities of people who saying, well, I don't have to get the vaccine because COVID hasn't hit our area. So people think that the vaccine treats it. It doesn't. It only helps to prevent it. When we talk about this, we hear the term fully vaccinated people. And so very clearly, a fully vaccinated person is 2 weeks or more beyond that final dose of the vaccine. Anyone else is not fully vaccinated. So you may have started it, but if you're not 2 weeks beyond that final dose, you're still not fully vaccinated. This category also includes the people who cannot receive the vaccine because of health or medical issues. You know, and I would say I personally know 2 people who, because of their health conditions, cannot get the vaccine. And then we also have the people who have chosen not to receive it and the people who still aren't eligible. And let me just, at this point, I'm going to stop my share. And Kathleen, you had a lot of points about the vaccine.
And you were going to share my doc.
Yep, I will do that in one moment here.
Okay.
When I can get my computer behave.
Go ahead. Hard to share from an iPad, so John's doing that for me.
Yeah, okay, here it is.
Okay, one of the things I wanted to say first was at one of the virtual workshops I attended that was put on by MDH, or Minnesota Department of Health, Commissioner Jan Malcolm said, we're all trying to develop a plan with imperfect information. And it was especially that way in the beginning because we did not know a lot about COVID. We had to live with COVID for a while, study it, research it, see what was happening to develop plans. And that's why guidelines or recommendations have changed over time. And one of the biggest changes, of course, was in late spring, recommending that everybody wears a mask. And then the governor instituted that in the state of Minnesota in July. But anyhow, one of the things I think we can celebrate, however, is that we do have some good vaccines. They're effective and they're available. They're very available now. Every place in Duluth is actually just begging people to come in and get vaccines. So the problem is getting the people to show up. The first vaccine that was authorized by the FDA was, of course, the Pfizer. And that came with a lot of strict storage requirements, temperature controls, how long, once you've reconstituted it, how long it was viable. And now Pfizer has been approved for anyone over 12. So the 12 to 16-year-old group is now getting vaccinated, which is wonderful for schools and wonderful for sports and other activities that take place, and should decrease some of that school contagion that has been happening. They're currently also working on testing children in the 6 months to 11-year-old category. And some of those tests or trials are taking place in Maryland, and they hope to have some positive news by the end of this year, if not early 2022. I know that Dr. Fauci was very excited about that. And the Pfizer vaccine, of course, is 2 injections and is going to be given 21 days apart. The Pfizer and the Moderna are both messenger RNA vaccines, which is a different system of vaccines that we've had in the past. And what it means, it delivers a tiny piece of genetic code from the SARS-CoV-2 virus to the host cells in the body, thus giving those cells instructions or blueprints for making the spike proteins, so that once your body comes in contact, or you come in contact with COVID, your body can initiate that immune response. And it depends on what studies you read, but the Pfizer vaccine is thought to be 95% effective in preventing COVID in those without prior infection. And it's the major part of that is that if you do get an infection, you don't get as ill. And so it really reduces death rate and hospitalizations. And initially, if you go back to New York area and the East Coast, hospitals were overrun with patients and having a lack of supplies and ventilators and those types of things. So that's been a real plus once people have become vaccinated. And even in the last surge we had in Minnesota, Commissioner Malcolm felt that would have been much worse in our state, but even with the few or the lower number we had vaccinated, it helped prevent a higher death rate and higher hospitalization, and certainly was a benefit for those 65 and older, who we currently have an 88% vaccination rate. Let's see. And CDC determined some of this information from reviewing healthcare personnel, first responders, and other essential frontline workers. And in real world situations, they found it to be about 90% effective. And the other thing they've been able to look at and have a pretty good feeling about is that it's very effective against some of the variants we have. Moderna was the second one that was approved for those 18 and older, and it's also an mRNA vaccine. And the storage requirements are still fairly stringent, but not as stringent as the Pfizer. And that's also a 2-injection vaccine and 28 days apart. Clinical trials show that it's very effective in preventing severe illness. However, in individuals over 65, that effectiveness drops to about 86%. And they have also studied healthcare workers, frontline workers, and first responders in real world situations to get a feeling for what the effectiveness is. And they're currently looking at whether it provides protection from the variants, and the early research indicates it does. Johnson & Johnson's Janssen vaccine is a carrier or virus vector vaccine, which is a weakened or inactivated virus that is used to make the vaccines. And that was the last one approved in February 27th. It was put on hold for a while because of 6 cases of unusual blood clotting, and then it was reinstated on the 23rd. I think some of the Johnson & Johnson vaccine is currently on hold again due to it being contaminated at a plant. It's easier to store and it's only 1 injection. So for individuals that you're not sure if they're going to come back for the second vaccine, that's a good one to use. I know we've used it within the homeless community in Duluth because we have a one-time episode with that client, and we get the vaccine to them, and we feel they're fairly safe then. It has a lower efficacy, and but it's higher in its response to preventing severe illness. And that really is the primary thing we hope to get from the vaccines, is to keep those hospitalizations and deaths down. And it also has proved to be fairly effective against the variants. Let's see. Oh, and then early data suggests now that fully vaccinated individuals, if they do become infected with COVID, they do not shed enough virus to infect others. And that was one of the points where CDC felt they could move forward and say fully vaccinated people no longer needed to wear facial coverings, that they could gather inside and outside and with groups of other vaccinated people safely. Another thing that's on the horizon is the development of a pan-COVID-19 vaccine. And pan just means expansive or across. And it's a vaccine that's currently being worked on that will induce a cross-reactive response to current and emerging viral variants. And it will be used either as a first-time vaccine or as a booster. And I heard Dr. Fauci speak about this several times at the news conferences they hold, not every day, but so that seems to be promising. And how long does our COVID vaccine that we've received last? Because we haven't had a full year, we're not quite sure, but there's a pretty good indication that it does last at least a year, and we will need a booster. The seasonal flu vaccine, is normally only about 40 to 60% effective, and usually does not have a year's worth of protection. One, because the seasonal flu strains can change quickly. So just a suggestion, do not laminate your vaccine card, because if you need a booster, they need to add it to it. And an area of discussion with some businesses, airlines, and entrances into other countries is the use of vaccine passports. Very controversial at this time. I know some college and universities have already indicated this will be a requirement. Some businesses might be looking at requiring it, maybe some gyms and that type of facility. And then what is herd immunity? We hear that that's what we're aiming for with the vaccine, to have enough people immunized to reach that herd immunity. And that's simply what it is a certain percentage where we feel that enough people are now protected that it's not going to spread easily within the community, and actually got its name from an infectious disease that was spreading with cattle. And so it became herd immunity was what it was called. Currently, there's a modeling done by NPR that indicates if we would receive, let's see, where did I write that? Like 10,000 shots a day, or 10,000 vaccines given a day in Minnesota, we could reach that 70% of at least one vaccine being administered by sometime in the first 2 weeks in June, except our vaccination rate has been decreasing. Oh, June 24th would be the earliest we would reach that. And the concept of the level that we would reach herd immunity has changed. Originally, the requirement was that you were fully vaccinated, and now they're going with at least one vaccine has been administered. And that was of concern to me. And I was also caught off guard by the governor's relaxing or doing away with the mandate.
So I'm going to pick this back up and kind of lead into that next part here. Just a second. And if I can get this to show again. Now, is this showing again?
It is.
Okay. So the new guidelines that came out from CDC for the face mask. And remember, this is two different ones. One guideline for people fully vaccinated, and then a different guideline for those who are not fully vaccinated. And the guideline from CDC is that fully vaccinated individuals, that we really don't need to wear masks anymore, that we can start to go about our daily business without masks. For the not fully vaccinated, there's no change. It is still the recommendation to wear masks in all indoor settings and large outdoor gatherings. Now, we take this in light of what happened in Minnesota, and a comment that has been heard by a lot of people out in the community: does this mean the pandemic is over? The answer is no. The virus is still around, the pandemic is still going on. It is still happening, but there are so many people fully vaccinated that we can start to go around with this, with some less restrictions. In Minnesota, our new mask mandate was basically to remove the mandate. It's no longer required, except there are organizations that are required by regulations or regulatory agencies to still have masks. Long-term care facilities, healthcare facilities are one area. If you want to go in, you will mask. Another one is with transportation, and we see this on the news all the time. Airplanes, trains, buses are still mandated. I was just looking again at some of the news reports from the airline industry where flights are being diverted and landing and removing passengers who refuse to wear masks and then taking off and continuing the rest of the way. Local governments still have the right to mandate face masks. Down in the Twin Cities, both Minneapolis and St. Paul still have the mask mandates. Individual businesses can still require masks. And what it really goes to say is we can go, in Minnesota, we are allowed to go above the state mandates. We could not ever go below them. And then there are still a lot of recommendations for different industries as to what they should do. And so this now goes to individual congregations. And I'm going to finish up a little bit here and then have Kim and Kathleen add input on this. But at the local church level, things to consider as you are moving forward and wanting to move forward. What is the vaccination rate in your local area? You know, Cook County is extremely high, not in all parts of the state. Another thing they keep on saying is look at the infection rates in your local area. If you are seeing infections climbing, remember it is climbing in that population that is not fully vaccinated. Think of your membership in your congregation or the visitors. Trying to estimate how many of those people would not be fully vaccinated. If you're a congregation with a lot of families and young kids, the children are not vaccinated. So consider who is and who isn't. Are you looking at indoor versus outdoor? And then with this, also be prepared to make sudden changes. You know, if all of a sudden everyone decides to get vaccinated, we can probably loosen. If you've loosened and all of a sudden there's a big outbreak, you may want to start tightening up again. Again, to remember, there are some people who will wear a mask because they are in a high risk group and they're in a group that can't be vaccinated. There are those who are going to wear a mask because they are more comfortable that way. I fall in that group. I am still wearing a mask. And then you are going to have some of the people out there who are literally going to say, I'm just not going to wear a mask, period. So remember, you got to have that whole spectrum. And with that, Kim and Kathleen, I'm going to open this up to you guys for some thoughts.
I can just quickly add in that right now the numbers in terms of infection rates are tracking down in the area and in the state. So even though vaccination has kind of stagnated, the numbers of COVID cases are going down. And then the second thing I want to say is just, I think John's right. Every congregation is going to have to do the calculus for their organization and their congregation and try and figure out the right mix of what's appropriate, and then communicating that in a way that empowers individuals to make their decisions, right? I'm kind of like John, I'm in that category of I'm still comfortable wearing a mask. I have kids that are able to be vaccinated and kids that are too young to be vaccinated. And so I want to protect the youngest one too, right? So people are going to have families that have a mix of vaccination statuses within them. And so just to kind of honor the choices that families are making on top of the ones that we're making as congregations.
The points that John made, that you have to evaluate what you're going to do in your congregation, those were actually part of our preparedness plan. And I never looked at our preparedness plan as one set plan. And I've had 3 revisions, and I just redid the 4th one based on what our state mandates were at the time and what I felt was appropriate to do. And then the governor's announcement came through, and I needed to relook at things. And at this point, we're not changing anything in church. We'll still wear facial coverings or masks, and what I plan to do is look at that in another 2 weeks and see where vaccination levels are and what the current infection rate is. I was pleased to see this is the 2nd week we've had a decline in St. Louis County, which is the county that Grace Lutheran presides in. I do know that early on, when our first in-person service was February 28th, and right after we started meeting in person, that's when that 3rd wave started to happen and continued to rise. What I did look at, and this was my thinking, and I don't know if it's helpful, everybody who was in church was a senior. I know from them sharing information with me, not collecting information on them, they were all vaccinated. So based on those 2 things, we continued to meet, but we were prepared to stop services if necessary, and especially if there was a case related happening at Grace. Now we have some younger families coming back. So I want to wait and see what the county vaccination rate is, which I think St. Louis County is now at 62%. and those over 65 at 88%. And we'll evaluate it at that point. I would like to allow some individuals to go with, and I can't say I'm allowing, but suggest that some individuals go without the wearing of a mask. One, we have a fair number of very elderly who find it hard to breathe with the mask on, and they're vaccinated. So I'd like to make that possible for those that are fully vaccinated at some point, to make them more comfortable. I know some are choosing not to come to church because it is hard for them. They have some breathing issues.
Okay, there was a couple things that had come up a few weeks ago that I just wanted to put some thoughts on too. One is about Vacation Bible School. And again, this is something that each individual congregation needs to look at, is who is going to be attending it and who's going to be working. So who are the ages and their potential vaccination status? Is this going to be done indoor or outdoor? You know, the more that could be done outdoor, the safer it becomes. Can you look at having the kids in either cohort groups or pods, kind of like the schools do, to keep them together through the whole time so that we reduce exposure? And just thinking a little bit, there's a lot of health with this. As you're doing Bible school, is health incorporated into that in a kind of more of a fun or positive manner, not so much negative? And with that, Kim and Kathleen, any thoughts?
Well, I like the idea of pods, and this isn't in relationship to Vacation Bible School, but into groupings within our church. I know of several people that spend a lot of time together. They're in and out of each other's homes. They're fully vaccinated. And so to allow more room in the sanctuary for physical distancing, they're already a pod. They're together. They can sit together in church. I'm not quite sure what our youth director plans on doing with Vacation Bible School, but we're usually outside quite a bit normally, and I would assume that that's what we're going to be doing this year.
Yeah, I know our, instead of Vacation Bible School, there's going to be a traveling camp experience for the kids. And in part that was chosen because that, and I'm forgetting the name of it. I know somebody here will know the name, not me. But they have really taken safety into consideration. I will say that for the kids who are in school, the rule is to continue to wear masks. The Minnesota Department of Education, even with the new rollout of the guidelines from the governor, they've decided to continue following the plan they put in place back in the fall. And so the kids, so even my oldest, who is almost fully vaccinated, she is continuing to wear a mask every day at school. Every kid in school across the state is wearing a mask. And I'm guessing that for the littler kids who are not fully vaccinated, if indoors, ought to be wearing a mask, and washing their hands frequently in a VBS setting.
Okay, and then the last thing that I remember had come up a couple weeks ago was thoughts on summer camps. And I know, I will say, as a kid, I went to a lot of summer camps myself, so it holds a dear place to me. But again, if people are looking at that, you have to be upfront and ask the camps, what are their policies? What protocols do they have in place? And again, looking at face mask use requirements. Are they going to keep cohort groups or pods, or are they going to allow free intermingling? Again, indoor versus outdoor activities. And then also really look at the day camp versus the overnight camp, because an overnight camp puts a whole nother level of complexity into it. You know, and if it's a day camp, it's, you know, there's less exposure time. And so those are things that people are going to have to consider when they look at the camps. And with that, I'm going to stop my screen share. And Raleigh, I'll turn it back to you for leading for the moment.
I just had one thing to add about camps. I would be interested to know how they screen. You know, do they do a screening every day if it's a day camp, when the children arrive, to see if they're ill, or communication with parents to make note of symptoms, you know, what symptoms they should make note of. Although there's a lot of asymptomatic spreading of COVID, but if you can catch the one where there's some symptoms, that would be helpful. And the same for overnight camps. How do they screen ahead of time? Do they want a negative test before they come? What else might be in place?
And I know all of our Bible camps are looking at the protocol, trying to figure out the best way to have a safe camp, summer camp. Oh, and a kitty just went in front of the camera here. But this is all helpful information. Team members, there's one question that's been asked a couple of times. Can you speak to the singing and speaking at an indoor worship?
Well, I know that the recommendation has been not to sing, but in the MDH handout, and one of the MDH guidelines and one of the CDC guidelines, they do say singing with having a mask on is okay. And we do sing in our church with a mask on. Singing is a big part of any worship service. They're socially distanced, they have their masks on. For the most part, I will tell you, the larger number of people who attend church are all vaccinated. What I request is that we're not going to have any operatic solos in the pew. So to do it more of in a speaking tone or a speaking voice, rather than being the lead in the musical. So that's what we do in our church, and it is an okay thing according to CDC and MDH. And I know some prefer not to do that.
The Catholic Diocese today ordained the new Roman Catholic bishop for this diocese, and our Bishop Amy was present with that. Mm-hmm. And she shared a little bit afterwards how hardly anybody inside the cathedral church wore masks, that there was singing, and she felt, you know, nervous or, you know, unsure or whatever. But anyway, question was asked from D. Hillstrom: small congregation without young families. All of the regular members have been fully vaccinated. What can we do as far as fellowship and Bible study?
The CDC says people who are fully vaccinated can gather without masks. And we've been doing that at Grace in small groups. We have a quilting group, a widows group, a Bible study, the library team. I'm trying to think of all of them, that they're all fully vaccinated. They shared that information within their group, and they meet without facial coverings.
And again, as all three of you said, that it goes back to the local congregation to look at the numbers locally, to get a sense of what percent's been vaccinated, what the new cases every day, and to make a best decision based on the information, the data that's available to you. I know there are some that would like the synod bishop or the synod office to say, this is the way it's going to be. We're not going to do that because we live in 13 counties throughout the synod, a variety of locations. So it's a tough situation in terms of not having one answer or one size fitting all situations. I assume it was Dave Erdman, might have been his wife, Beth, said that there are some VBS packets available through some resource centers. Parents need to be willing to guide the children through those pods or centers, depending on the approach.
Raleigh had sent the group an email question earlier today that was relating to other groups coming in and their policy versus the church. And to put it down very bluntly, if your individual congregation, what are your individual congregational policies? If you are still mandating people to be masked, any group that comes in has to follow your policy. So that group may say, we don't mask, but we want to meet with you, and your congregation says you have to mask here. You know, now if you aren't requiring masks and the group wants to mask, that's fine. But at a bare minimum, they have to meet your individual plan at your church.
All right, there's a couple of other questions that have popped up in the chat. What about fellowship time? Serving coffee, punch, lemonade, goodies? Any suggestions along those lines?
Because we're still wearing masks, we don't have a fellowship time. And we'll probably wait until we reach that 70% vaccination rate in the state or St. Louis County to initiate that again.
Yeah, we kind of see that as being secondary to the central mission. And so that will, once we have what worship in person, kind of get that down, then that'll be something we do at a later time. I mean, food in itself is not highly risky. It's the fact that you're taking masks off, which increase, and sometimes circulating through the same space. And that makes it slightly more risky, especially for those who are not vaccinated fully.
And again, under the state guidelines, it says that if we're going to have food activities, then we have to follow the guidelines for food service.
Mm-hmm.
And, I think most of us just don't want to go that extreme.
Sorry about that. The cat moved my camera on me.
This cat doesn't have a white stripe on it, Raleigh.
Well, yeah, that's Synod Assembly. I had a cat walk under my feet in the sanctuary where the Synod Assembly Central was taking place, Salem Lutheran in Hermantown. And I was reaching over to pet this nice little kitty, and then I saw it was black with a white stripe. So no, not this one. I know in our synod there have been a couple of congregations that have done either the hybrid or in-person worship, and then for fellowship have moved outdoors. In my mind, that lowers the risk, allows some time for fellowship, sharing of goodies, that sort of thing.
Yeah, we've considered that, but it's so weather dependent. And so until we move into maybe June, we've kind of put that on hold. And I will say that's the one thing our members really miss. They gathered after worship, they stayed for an hour or more and visited with friends. They had some real connections and they missed those connections. And that's what they're anxious to get back to. So we have looked at outside gatherings and having, in my thought, having the coffee pre-poured in disposable cups, pick it up, and then some item you can grab and have informal seating arrangements outside.
And Siobhan, I'm going to come back to your question, but the next one, and Kathleen, you were just talking about this one a little bit, food, fellowship, to have it as a to-go item, you know, pre-packaged donuts, cookies, coffee, is a safer option. So we can consider that. And then Larry Anderson asked the question, current guidelines for food service.
What type of food service? I used to teach food safety classes. So what kind of food service do you mean, like whole meals or?
Larry, yeah, unmute yourself. And
I have been trying to sort through the current state guidelines for food service in general. I'm, immediately concerned with coffee times, what requirements are in place still in the state. I believe the guideline target is something like July 1st for removing all of those barriers, which is a little concerning to me. But are we talking just basic safe food handling stuff here, or does somebody know of what the current state guideline is?
Well,
I'm kind of scrolling through it right now, and it is still the distancing, the separation between your groups. There's a lot. And they do say one of your things that is your best recommendation is kind of that grab and go type of thing. And so I think it goes back to what other people have said. If you can make the to-go bags and then let people do it outside, because that fresh air, the air circulation makes it a lot safer.
Yeah, there's a difference between what restaurants can do and what you can actually do what you want in your church, but you should practice safe protocols. The state isn't going to come in and tell you can't do that. But you need to, it's the laughing and talking and eating the food where people who might have COVID, maybe asymptomatically, they do place it into the air. So that's why we're opting for the outside version of the coffee to go and a small item to grab. Restaurants now are at a higher capacity ratio. I think it's 75%. And by the end of May 28th, May 27th, all social distancing guidelines are gone in restaurants.
Thank you. That's helpful.
And we'll go to Siobhan Miller's question. This goes back to the conversation about seating and being in pods, social distancing. We were talking about VBS and other settings within a church environment. Is that for both with and without masks? And what's the recommendation for social distancing right now at this point?
I think that's what the recommendation was, what Kathleen was saying about how by the 27th, there's no more,
Right.
right, no more recommendations for social distancing. At the same time, it's still a practice to consider and to think about. Again, depending on what the vaccination status of the congregation looks like and what the rates are in the community of COVID. And if your space can handle it, there's no reason not to do it. If you are in a building that may not have the best ventilation, distancing will help offset that lack of ventilation. And so I think, again, this is one of those areas where, to the extent you can have vaccination or greater masking or greater distancing or greater ventilation, all of those things contribute to the overall risk of COVID. And they can kind of, think of them like a teeter-totter, right? Like a 4-pronged teeter-totter where they all can balance each other out, perhaps. And so if in your space, distancing is less possible, or encouraging people to, stick with their families and leave some space around them in the pews, then you might want to open some windows and put a fan on if you can, or know what your filter system is like if it's a colder day and you're going to have heat on. If your building is less ventilated, or you have a congregation that's less vaccinated because maybe it's got a lot of really young families, then you might want to encourage that distancing to offset the lower vaccination rates. So I would encourage you to all think about these things, not in isolation, but in relationship to each other. In terms of distancing. I know we're going to still encourage distancing, at least for our first, we are at Lutheran Church of the Good Shepherd, our first service is this coming Sunday live in the sanctuary. And we'd like to be more cautious at the beginning, because it's easier to kind of go into less caution than it is to roll back. So I think if you can distance, still try to.
One of the things Kim brought up, and of course it's my pet subject, is ventilation or air exchange. And that was the first thing our congregation, or I felt we needed to work on before we could ever meet in the sanctuary, because we had no air exchange. And now we can get 100% air exchange. So if there's anything you want to do long-term, not just for COVID, but for relief of allergies and seasonal flus, look at how you might improve your air circulation, where you're actually bringing in more fresh air. That's a long-term goal, and it would be nice to start working on it in the summer, so that when even seasonal flu visits us again, that you've arrived at some solutions. That's a good investment to make in your building. And the other thing is to know if you have HEPA filters, because they will grab small particles. And the other thing is to have a routine changing schedule of your HEPA filters. Those are all things that will help. And of course, in weather that's nicer, you can certainly open windows and have some good cross circulation taking place.
How about some words on having bake sales? And my hunch is reducing the risk would mean maybe prepackaged items.
Mm-hmm. And I think John gave some suggestions last time. And actually, from the food safety standpoint, I wanted to add something to that in bake sales, you should stay away from custard products and cream products unless you can have them refrigerated at 40 degrees or lower in a cooler. And I always like to suggest, and this has nothing to do with COVID, that people put a list of ingredients of what's in the bake sale item. And that's helpful, especially if there's any nuts.
I did an update at the Synod Assembly and I talked about bake sales then, but just as a recap, it's looking at the ventilation, and your best is going to be do it outdoors. And if that means setting up some tents so you can have tables there, do that, but outdoors would be best. Your traffic flow, still keep a one direction flow through it. So we reduce a lot of mingling. Again, looking at that physical distancing, and as far as I haven't seen that the physical distancing has been decreased from 6 feet. As far as I know, it's still 6 feet.
Yeah, it's still 6 feet.
Yeah, the exception is children. Children in schools can be 3 feet. The risk is supposedly even, I mean, before vaccination, they were less likely to get COVID, but so it's 3 feet in schools, 6 feet everywhere else.
Thank you, Kim, for knowing that one. And the other thing, put markers out so people kind of know what 6 feet apart are. I would still say if you're going to hold a bake sale, you don't know who's coming through. You don't know if they're fully vaccinated, partially vaccinated, unvaccinated, high risk who can't get it, someone who doesn't believe in getting a vaccine. I would recommend for a bake sale telling everyone you need to be masked to come through as a protection for those who can't get the vaccine or don't have it. Again, wrapping items individually so they're not exposed, and label them, price them. People should be able to walk through, pick up what they want, and then at the end stop and pay. But I think doing that, you can safely hold a bake sale.
Are there other questions, comments?
Somebody had a question online, and I think I sent an answer in about an employee who does not want to get the vaccine because she had COVID. And CDC recommends that whether you've had COVID or not, you should get the vaccine, that the immunity or the antibodies you make from the vaccine are better or stronger or last longer than actually having a case of COVID.
And we have the question with worship. What about Holy Communion?
I would say that really hasn't changed yet. There's still ways to do it. It just depends on what individual congregations want to do. Do you want to do communion with one element only? Do you want to do communion with pre-packaged bread and wine? At the Synod Assembly, at the host site, they have little individual wine. They're almost like a little medicine cup that you rip the top off to drink it, but it's pre-done that way. There's lots of ways you can do it, but I think the big thing to say is that we're still not ready to go back to the point where you stop, you get the bread and or wine and eat it at the altar rail or up at front. You should kind of keep on moving. So that's just it. I think we're getting closer. And I think up until now, congregations have come up with very good ways of still having communion and doing it safely.
Mm-hmm. We have a continuous line where they're socially distanced, and they are given the wine and the bread, and they step aside and take it and then move on, and the next person. And it's an arm's reach for both, and so you're apart. If you go to the people who had questions about specific questions about vaccinations, the CDC website has a lot of information, and they have one document that's called Frequently Asked Questions about COVID-19 Vaccination. And that specific question about, if I already had COVID-19 and recovered, do I need to get vaccinated with a COVID-19 vaccine? So I'll read what CDC says. Yes, you should be vaccinated regardless of whether you already had COVID-19. That's because experts do not yet know how long you are protected from getting sick again after recovering from COVID-19. Even if you have already recovered from the COVID-19, it is possible, although rare, you could get infected with that virus again. And then it says, if you were treated with monoclonal antibodies or convalescent plasma, you should wait 90 days before you receive the COVID-19 vaccine. So very specific recommendations from CDC. And I find at the CDC website, if you go to where the little symbol to search is, you can put in really what your question is, and they will bring you to a variety of resources. And a lot of the answers are very specific and helpful.
Another question that's been asked, is it legal? And I will add, is it moral to ask a worshiper if they are vaccinated? And I know, Kathleen, you got some pretty strong ideas on that one.
Well,
I can tackle the legality piece. If
you can't.
no, you actually can. It is legal. It is not. It's not HIPAA protected. But different HR organizations are suggesting it gets to that slippery slope when you start asking for proof. You can ask people to show a vaccination card. You can ask for self-report, whether it is desirable or, to get at Raleigh's question, moral or ethical is a different, that's different. With the legal side saying, ask for very bare minimum. Like, so for example, if a person says they're unvaccinated, then to start asking why becomes where that you're crossing the line into HIPAA protected information about personal health status. So.
And my feeling is, you know, people have been so excited in our church once they get the vaccine, they're sharing it with everyone. They want everyone to. And so, and many of them call me up, email me, text me and say, I've gotten it. And so knowing our membership fairly well, I know who's been vaccinated. And I will say we have a very high vaccinated rate, but we still continue with social distancing and masks at this point, and we will for a while longer. There's a group within MDH, it's called Minnesota MDH Faith-Based COVID-19 group. And they do have monthly webinar meetings, and I don't know if any of you have participated in those. I try to, that's usually once a month. And they got a question about how does the vaccine status and the HIPAA or data privacy apply to churches? Can we require people to be vaccinated if they are serving coffee, lunch, etc.? Well, I did work for Minnesota Department of Health, so this is a kind of standard answer. The Minnesota Department of Health cannot give legal advice. You will need to check with your attorney or legal experts that you use for any legal matters to ask those questions. And they just go on to say vaccination records are an individual's private health-related data. And MDH knows how they handle private data and what legal sources they use. So they would not give an answer. But overwhelmingly, I have to say people have been more wanting to share it. than anything. And so that's given us an indication of where we're at.
I think we need to acknowledge that there are going to be that group of people out there who are not going to get vaccinated. And because they don't believe in, either they don't believe in vaccines or they don't believe in COVID, whatever it is. But if you ask them, they'll say, yeah, I've been vaccinated. You know, so we have that part of the subgroup in the population. You know, we're kind of stuck at taking people's word for it. Unless it's a person I truly know has been vaccinated, I look at them as an unknown. And I'm going to treat it as it's an unknown to me. You know, I'll personally say right now, I am very disappointed that the mask mandate was lifted as abruptly as it was.
Mm-hmm.
We have not truly reached the vaccination status statewide that we should to do it. And I think it needed to be a better phased in approach. And there needed to be a lot more emphasis on the fact that there's a huge difference between fully vaccinated people and not fully in terms of who needs masks.
I will say that I felt Governor Walz has done a good job in the face of a lot of criticism. He stood firm on many things, but this too, I was disappointed in, because to continue a policy that is no longer a mandate, you know, I'm the face that's saying this is what's going to be, and sometimes I'll be honest, it isn't always comfortable. So it was nice to have that mandate to stand behind. But we can still do what's right, whether the mandate is there or not.
I'm going to shift gears a little bit, and Catherine Anderson, hopefully you're still on. I'm going to kind of direct this one to you. As you connect with youth and family ministers, youth directors, are there some concerns, some questions that you're hearing from your colleagues, especially as they do ministry with children, with youth, with young adults, with their families?
Are there concerns? Yes. Would you like more than that? I'm sorry, I don't mean to be snarky at this time of night. Yeah, I mean, I think as I kind of shared earlier, you know, I meet weekly with the youth directors, and the issue that we have is that we are one of the few places in the world, in our culture, that is intergenerational. And so you have, we love hearing that the older generations have a high vaccination rate, but then you've got our young people who are just now in the 12 to 15 range, of course, getting the vaccines, but are not fully vaccinated. As we head into summer, you know, we're doing our LYO leadership camp the second week of June. Even if the kids that are in that age range had stepped up and gotten the vaccine the very first day it's offered, they would not be fully vaccinated by the time they come to our camp that's held in early June. So you have to think through that. And then of course there's the younger ones. And then the other issue that you have with youth and families is, Kim, you brought that up, you've got the mixture. And so many of our volunteers are older in vulnerable ranges. And then the young children do not have those vaccines, and that's where we're seeing many of the numbers as well. And so there is no perfect answer. It's everything the team has been sharing. I think, you know, that you take a look at infection rates, you take a look at what the vaccination rates are in your county. And that's important. Raleigh mentioned we've got 13 different counties. St. Louis County is doing great with vaccination rates, and that helps our young people when the adults around them are getting vaccinated. But we've we've talked, I'll use Pine County as an example, where the vaccination rate is more in the 30% range. That's a whole different scenario. And maybe I don't have those numbers right, but it varies like that. And so that's why it's important to take a look at what your vaccination rates are and your specific area. So and then of course everything that we do in youth and family ministry is what you should not be doing to pass on COVID. You get in small groups, you play games and touch each other, and you sing and you laugh and you move around, and to things like even thinking through transportation. Our young ones can't drive themselves, and so how do you transport to different activities, and are you going to allow other parents to take your kids, and some of those questions? It just makes there's one complexity after another. As I'm planning camp, and I'm watching our youth directors that are on this call nodding their heads going, yeah, I've got 20 games in my back pocket that when kids get bored, I can do on a dime, and I probably 30 more that I can make up on the fly. But now I have to rethink everything that I'm doing because I can't do them in the normal way that I do. So we're moving forward, and I want to come back. Our camps, the Lutheran camps in our synod, I can't speak for camps that are not ELCA, but the ones in our synod have done a phenomenal job of thinking through COVID scenarios and protocols. They have their protocols listed on their websites. I would feel comfortable sending my kids to any of those camps. Kim talked about Camp Onimia coming and doing day camps, and great offering with that too. So I don't know if that answered the question, but it is a constant concern for our youth and family leaders of how do we continue to move forward. A lot of stuff has been moved outside, and especially as we move into summer, that is helpful. But keep our youth and family leaders and volunteers in your prayers, because they have been working so incredibly hard this year to reimagine everything that they do, and we'll continue doing that for the next 9 to 12 months until the little ones have been vaccinated as well.
Catherine, that's exactly what I wanted to hear. It's sharing from your perspective what you're seeing, hearing, because it adds an additional component to what we do as church leaders.
Mm-hmm. Can I add one more thing? I in Tuesday's Youth eChat that you can get on that website that I just put there, I was kind of hitting some of this. The other thing to really keep in mind, and especially with young people, but I think our adults are that way as well, is keep in mind the anxiety that our young people have around this. And it is huge. That there's, of course, everybody's the spectrum, right? And so there's some that's like, yay, it's all done. And that feeling that we get with the ease of the mask mandate. But there are so many of the young ones that are have already been dealing with anxiety in a variety of ways. And now they have to think this through. And then you have families who are so overwhelmed and so stressed from this year of having to do things so differently. And now they have to think through, okay, well, the state's no longer putting protections in place. Now I've got to make these choices, and I've got to send my kids into activities and into friend groups that may not have the same values that I have around this. And I want to keep my kids safe, and they may have health issues and different stuff. I think that's a really big concern as well to be paying attention to. And another thought that went through my head, and it just went right back out the other head. So,
well, as you were talking, Catherine, I was thinking about what you've talked about Camp SJ and some of the components of that piece. The grief.
Yeah. working through the grief. If there's Springtide Research has been doing just amazing research on the mental health of young people and how to help them come back after the pandemic. And many of you know me, and you know that every time I say young people, I think adults fit into this as well. But they have a great resource. When I'm done talking, I'll link to it, that talks about 8 things that we have to do to help Gen Z, those young ones, return after the pandemic. And the first one of that is to give them space and to create safe footing for them to be able to come back and to name their grief and their losses, and not to expect that everything is normal. Oh, here was the thought I was going to share, because I think one of the very first comments that I heard after the mask mandate was released, both by the CDC and the Minnesota governor, was from through an adult, of a young person's comment of, well, great, everyone else is safe, but I'm not safe. And to walk into every decision that you're making in your intergenerational, knowing that our young people are thinking of that, and that the Springtide Research is really showing too that even if on the outside, on the surface, kids are looking like, oh, it's all back to normal and I'm all good, inside they are really reeling from this last year, and we have to be paying attention to that.
Mm-hmm. And I think parents have those same feelings, you know, as people who are vaccinated were rejoicing that there's things they can do without wearing a mask. My nephew's wife said, oh, good, now we're in lockdown again. She said, they have a 10-month-old and a 4-year-old. And she said, now I don't feel I can go into Target or Super One or any of the stores to buy things. Now someone will need to stay home with the children and one of us will go, or I'm back to ordering my groceries, because now she doesn't feel safe bringing her little ones in. Whether they wear a mask or not, you need both people to wear the mask for the ultimate protection.
Yep. And great comment, Susan. How do we care for our young ones and our families that are struggling? And one of the most welcoming things might be still putting the mask on because it's caring for the others.
Thank you, Deacon Susan, Catherine. I'm going to start to wrap things up here. Kathleen, Kim, John, any last comments you'd like to share?
No, I sent you some specific comments on the person who had an employee who wasn't vaccinated but had COVID. And she had some specific questions about masking and how long the virus could remain in the air. And I don't need to go through all of those. If you could share those with her.
I will look at my email probably tomorrow morning when I get to the office. But Kim or John?
I would just say, just keep approaching this with the grace that you have. There's a lot of obvious caring and concern on this Zoom call, and I would just, continue to keep the lines of communication open with the persons in your congregation, and realize that we're kind of all in this new phase together of where the state just rolled back everything, and that I think with that grace, and people will be understanding of kind of like that tweaking and the fine balance over the next several months.
And mine would be, think of the people who are not able to be vaccinated. And it could be age group, it could be health conditions or whatever. And what are we doing to make those people who are at risk people because they cannot be vaccinated, to make them feel welcome, to make them feel included, to make them feel part of our community? you know, it's as Jesus said, as you do these to the least of them, they're the least right now. What are we doing to make them part of us?
All right. Thank you to the team members for this conversation tonight. Thank you for all of you for watching, for listening, for sharing. I will, in the next couple of days, try to put something on the website with a link from Facebook from Facebook with some of the things that were shared in terms of links and that type of thing. And depending on how the video turns out, I'll also put that onto the website as well. The Lord be with you and also with you. Let us pray. Loving God, we thank you for this day that you have given to us. And now as we head towards nighttime, continue to have your angels surround us with peace, with joy, with hope. Help us to be courageous and compassionate in our work, in our play, in our ministry, in our loving. In Jesus' name we pray. Amen. Thank you all. Have a good rest of the night. Goodbye.